Jane Burke, and I'm the County Superintendent of Schools. Welcome. So happy to have you with us. We have an opportunity to get some information from Dr. Willis related to the current status in our county. We're going to be updated on the small changes that have been made in the 30-point plan, along with the site-specific plan. And then while the information related to school waivers will not be available officially until this Friday, we'll be able to give you some information related to that. And so Dr. Willis, as always, thank you so much. Appreciate it. And we look forward to hearing the information you have to share.
Great. Thank you, Mary Jane. Good morning, everyone. I'll start with just an overview. I'm going to share my screen of the current status of the COVID-19 pandemic in Marin County. Can you see that? Mary Jane, can you confirm that you're seeing my slides?
Absolutely.
Okay.
Yes, sir.
Great. Perfect. And then after this overview, we'll get into reviewing with you our 30-point guidelines that are intended to drive the development of your school site specific protection plan, the SSSPP. And for any schools that are intending to apply for a waiver, that plan will need to be included in the waiver application. And we will also then go over the key elements of the waiver application process, and then open it up to questions. And I'll be joined by Deputy Health Officer Dr. Lisa Santora for some of this presentation. This is our experience of this epidemic since the start. It's been over 5 months since our first case. Remembering back to that early March when we had a member of our community who had been on the Diamond Princess cruise ship who became infected there. It was our first case and unfortunately our first fatality. Since then, we've had 3,152 cases in Marin County. This is numbers as of yesterday, so that might be a few more than that for those that look at on our website. And we invite anyone to follow the numbers. We have a lot of publicly available information that describes our experience of the epidemic in a variety of ways at coronavirus.marinhhs.org. This is the table that summarizes some of the key characteristics. One is that we've tested over 56,000 people in Marin County, which is more than 20% of our total population, so more than 1 in 5 residents. We have 3,000, again, over 3,000 cases. 122 individuals have been hospitalized overall since the start, with a total of 55 deaths. Or 56 deaths, sorry. Right now, there's 16 people in the hospital in Marin. 13 are individuals from our community, and 3 are inmates from San Quentin. That is the lowest number. That 13 from our community is the lowest number of people in the hospital we've had in over 2 months, which is encouraging. This is the data on the number of tests per day. We had set a goal of testing at least 500 residents per day and have achieved that goal, in fact, exceeded that goal. And that offers us a more precise understanding of both the incidence and the burden within our community, but also where the virus is flowing within our community and which groups are most affected, which has really helped us organize our strategy. There has been, as you're aware, and you can see it on the end of this, in the shaded in red, there was a problem at the state level with 300,000 or so records from testing that occurred throughout the state that got hung up in the software system in the state database and did not make it down to the local level. We in Marin County were less affected by that than most counties because we have direct relationships with the laboratories that perform testing. So we're able to see 2 independent sources of data, and don't think we we lost, missed a lot of records there. It looks like we had about 100 records it was only until that problem was fixed at the state level that we saw that additional 100 cases, which was a delay of a few days. But we had thankfully, based on our own direct reporting systems, had caught most of those. But I'd say it's a word of caution in terms of interpreting some of the most recent data until it stabilizes with the data system at the state. This is our demographic characteristics in terms of age of the cases we've had so far, and just calling your attention to especially for these conversations around school environments and students. We've had one hospitalization for anyone aged less than 19 total, and no deaths, and 96% of our cases are in people above age 65, of deaths, sorry, are above people age 65 or greater, and 70% of our deaths are in people above age 80. So we have sort of an exaggerated experience of what has been observed nationally and across the state of preferential impact or disproportionate impact in terms of mortality for our older population. We also have an exaggerated version of what's been seen across the state in terms of the disproportionality for Latinx people. In Marin County, 16% of our population is Latinx, make up 75% of our cases. That there's a disproportionality at the state level, but it's more limited. And this is obviously one of the most important drivers of our strategy here in Marin. This shows, we are seeing elevated case rates relative to other counties in the Bay Area. A lot of that is attributable to the fact that we are also testing in excess of any other county in the Bay Area currently. And so we have we are ascertaining cases where they exist. So we have good case detection, and that affects case numbers. So we also need to look at hospitalization rates to really know how to interpret that. And what this shows is hospitalization rates per capita. And we see that our hospitalization rates are the third lowest of all of these Bay Area counties named here. And this was before we had, and if we were to look at this today now with 13 in the hospital, we would be, have the fewest number of hospital per capita, the lowest hospitalization rate in the Bay Area. This is just to offer some context in terms of our policies, the shelter in place. We are on as you know, the California Department of Public Health has a monitoring list of counties that have incidents above 100 cases per 100,000 residents over the past 2 weeks. That allows the state to set limits on how fast, what can open and when. And we are in that majority of counties now. Over 90% of the population of the state of California is in a county that is on the monitoring list. So it really has become de facto the pace at which the state is moving is based on what is allowable for counties on the monitoring list. What that means for the business sector, and we'll get into what that means for the school sector in a moment, but what that means for the business sector is that we are only allowed to move forward with personal services outdoor. So we made that step yesterday for nail salons, et cetera. And then on August 24th, we intend to become fully aligned with what's allowable in monitoring counties by taking the step to move forward with hotels and short-term rentals if our incidence at the local level is below 200 cases per 100,000 residents over the previous 2 weeks. So here's how that relates to schools. As I said, due to our status on the monitoring list, we are unable to open classrooms to classroom-based learning in Marin County. And that's because we have more than 100 cases per 100,000 residents. That's just so we know how to interpret that, that's a retrospective view of the past 2 weeks of the total number of cases we've had. And then that's adjusted for per 100,000 residents so that there can be comparisons across counties. For what that means for us in terms of our numbers, based on our population, it would be about 19 cases. So when we get to that point, and this is our goal, right? We need to focus on this collectively. If we can get to that point where we're having, on average, fewer than 19 new cases per day, we will have less than 100 cases per 100,000. And that will that will reflect obviously a lot of improvement in terms of transmission and also allow us to come off in the monitoring list and give us more options for what we can open. The state does allow opening of schools to classroom-based learning for TK through 6, not for secondary, but for those elementary school ages, with the approval of the local public health officer and California Department of Public Health. And we'll be walking through, one of the objectives of this conversation is to walk through that process. If the case rates in Marin County are above 200, so twice that number per 100,000 residents over 2 weeks, the health officer no longer has the authority, even through the waiver process, to allow schools to open classroom-based learning. Right now, our incidence is about 160. So we're kind of in between. And so we are still on the monitoring list. And I would expect us to remain on the monitoring list for I would say several weeks. Obviously, no one has the crystal ball, and it's hard to, we are making progress. Our incidence has decreased. It's encouraging that our hospitalization rates have decreased. But we need to plan for the likelihood that we will remain above 100 for at least a matter of weeks, aiming towards mid-fall. We may be pleasantly surprised, and obviously we need to do everything we can to get off of that list as quickly as possible. So the waiver application process, we would require that there's adherence in the waiver application to Marin County Public Health and Marin County Office of Education recommendations for reopening, which we'll be going through shortly. The 30 elements, those need to be referenced specifically in how they are being adhered to in your school site-specific protection plan. And that would need to be attached to the waiver application. Importantly, every school, when we resume classroom-based learning, will need to have developed that plan. And we are available, in conversations like this to guide you through the elements of the plan, but also specifically as questions come up. We also, for the waiver application process, will require a determination of how the testing needs associated with reopening will be met by schools. We know that we've already issued a recommendation that school staff be tested, and that we will need to be able to do testing for students if there are clusters of cases on campus. And that testing capacity, the testing environment is getting more favorable. There are more vendors now offering testing. There are fewer constraints in terms of the reagents and laboratory capacity. And we're putting responsibility into the hands of schools themselves, especially in the private sector, for obtaining the capacity to do that testing. And we can support by offering lists of testing companies, and also have a testing operation that we're sponsoring at the county level through Color Genomics, that is also available through dialogue with us in terms of how we would arrange that. So the priorities for the schools are, in the waiver application process, are those that would be able to optimize outdoor space. Obviously outdoors is safer than indoors, just categorically because of dispersion of particles. And so that's something we'll be looking for in the waiver application, is to make sure that there's been every effort to try and optimize outdoor space. And then a demonstrated commitment to educational equity. And we'll talk more about what that looks like. The earliest any school would open in Marin would be the day after Labor Day, September 8th. We had signaled that in July, and earlier in July. Some of the concerns just for us to be thinking about as we enter into this unique school year with the pandemic is that this year could easily widen unacceptable inequities in education. This has been lively in national conversations and local conversations, and it's important to acknowledge. We know that distance learning disproportionately hurts low-income families, despite all of the excellent efforts to close the technology gap. That has a lot to do with the culture and the capacity in the household that is disproportionately impact, especially for low-income families. We're also seeing that public schools are less likely to apply for waivers to open than private schools, and that could increase the equity gap in education in and of itself. If the only schools that open to classroom-based learning are schools that people are private schools, that's a reality we need to think about in terms of what that would mean in terms of the outcome at the end of the school year, in terms of where that gap is. Families of means are finding alternatives to ad hoc learning pods with instructors. We're seeing this as, you know, there's a lot of activity currently happening now as parents are finding arrangements to meet the educational needs and the social needs of their children, knowing that classrooms are going to be closed. And one of the common strategies is forming ad hoc learning pods with instructors. And that's another, I think, source of potential gap in educational equity. And then unstructured out-of-classroom arrangements can increase risk of transmission. I want to be clear that, you know, as the secular activity happens, as people adapt to the reality that children will not be returning into that more structured setting at the beginning of the school year of classroom-based learning, that the arrangements that occur, if they are if they are unstructured and more ad hoc, might easily lead to more net mixing over a period of time, over a period of a week, than would have occurred if there was a structured, stable cohort within a classroom setting. So I have, as a public health officer, you know, have a concern that if we're not careful in terms of how we arrange the alternatives, that we could actually see more transmission. So the opportunities that represents for us is that we're, our first opportunity, and this is just for everyone, and this is how I speak to the community as a whole, not just the educational community, is that our goal is to drive down prevalence. Our goal is to reduce transmission in our community to allow schools to reopen. Of all the sectors that we worry about in terms of, you know, hotels and indoor businesses, indoor retail, no sector is more important than schools. It is one of the core societal roles is school. Getting our children back into classrooms is, I think, is something that we really want to organize our collective response to the epidemic as a whole around that goal. So that's, we need to do everything we can to drive down prevalence. And that's simple, you know, boils down to some very simple principles of covering our face, maintaining 6-foot distance, washing our hands, not engaging in gatherings outside of your household, the things we've been talking about all along. But those are doubly important as we seek to reopen schools. And we ought to make sure that the waiver application process supports equity. We also want to support out-of-classroom educational structures for low-income children to make sure that they also have opportunities for the kind of higher quality and safe gatherings that are being developed for families of means. And there's some strategies there that I think we could apply through leadership at the Office of Education and Public Health and others. And then we ought to make sure that all schools, and that's the rest of this conversation, make sure all schools are prepared for reopening as safely as possible. Ensure all schools are prepared for reopening as safely as possible. And that concludes my introduction. And now we'll get into moving through the 30-point guidelines.
Okay, Mike, are you going to put that up? Mike Grant?
Yeah, I'll put it up right now.
I'll stop sharing my screen.
Thanks, Dr. Willis.
Thanks, everyone. And if there's any questions that come up based on that presentation, we can address them when we open up to questions later.
Okay.
So here's the 30-point plan. So first, I'm just going to go through just numerically. We'll take them each. We'll just touch on each of them briefly. Some are general and some are more specific. And then as questions come up in your minds, make a note of those and we can go back to them rather than take questions on each one individually. Excuse me. So the first is that all activities are consistent with and will adjust to changing applicable state and local public health orders. I think that's an important organizer around all of this. I think one thing the epidemic has taught us is that we need to be adaptive and flexible as the situation changes. And that's both the situation in terms of the epidemiology itself, our incidents. We had a rapid increase in cases in mid-June and our strategies pivoted. We could have really great improvement over the next few weeks, and we would change our strategy again. And then obviously there's the legal side, the orders, and those also change. The state sometimes doesn't give us a lot of notice in terms of what the state guidelines are, and that's going to be also determining what we're able to do. So just to offer that as an overnight. So this could all change, but this is where we are now. Second, health and safety practices and protocols are in place, including hand washing, appropriate face covering, access to essential protective equipment, and up-to-date student and staff attendance tracking. Right, this is just a meta organizer again around the expectation of the standards, and each of these will be kind of more specifically referenced in later elements. Next, please. Importantly, we are requiring that training is provided to staff, students, and families, reinforcing the importance of health and safety practices and protocols. So that training is obviously in itself, the fact that training is an expectation is a reinforcement of the importance of those things. But we also don't want to make an assumption that just offering this in a general sense is sufficient. And that, the educational sector, I think, is probably the best to understand that really what we need is education to really be at our best in terms of adhering to these standards. And the way to provide that education is through training. So we want to make sure that each school has a plan for training staff, students, and families. And there's an opportunity in the waiver application process and the school site specific protection plan to outline what your training plan is. And I think at this, I'll do the next one and then hand it off to Lisa. So primary and secondary point of contact are established, identified, and trained at each school site. Actually, this is yours, Lisa. We can let you take this.
Of course. Hi, I'm Lisa Santora. I'm the Deputy Health Officer for the county. And this is the place where schools begin to interact with our public health department. Our nurses are working together with the Marin School Nurses Organization to ensure that we have a handbook and guidance for parents and for schools. And that's something that we are developing and hope to release very quickly, as you'll see the other documents released as well. But our first step in having a successful partnership is making sure we have a strong point of contact. We'll be offering trainings for these liaisons to public health so they better understand what is a line list and why we're tracking attendance and rosters, and how do we implement this, the scenarios, as we will have scenarios for the evaluation of persons under investigation for COVID-19, as well as scenarios where we do identify staff or students who have known exposure to COVID-19 or known diagnosis of COVID-19. So the first step to success is identifying a point of contact or a liaison to public health that will participate in training, and also will be responsible for really understanding the site-specific plan and making sure that the measures that are outlined in that plan are implemented. And that's another place that we in public health will be supportive to make sure that everyone understands what the components of that plan, and you have the supports that you need to implement the safety protocols that are recommended. And so that goes to our next one, which is what are these protocols? We can do so much. Again, there's a lot of change with COVID, but there's a lot of control we have over COVID. And that's really driven by intensifying our cleaning and disinfection, and making sure everyone has access to the equipment, the protective equipment that they need for disinfecting regularly touch surfaces, and also, again, minimizing as much as we can sharing those surfaces. So there's strategies that we will be engaging in, and we all have been engaging in, those of us who've been back at work, around increasing cleaning. The next step is, again, just health screenings. And again, this is where our community plays a role. We're following Centers for Disease Control and Prevention guidance around home-based screening. We'll be begin educating parents around what home-based screening looks like, and making sure, just as always, this is not a change, that they shouldn't send children who are sick to school. And also they should be aware of the potential exposures they have to COVID-19. And that's where we all, again, as a community, need to play our part in minimizing our social activity, especially as we try to get our schools back online and staying online, not just online virtually, but actually in the classroom. And so minimizing social activity, minimizing potential exposure to COVID-19, and parents will play a role in that. And that is a shift. That's one of our first big shifts away from how our pilots were launched, where there was temperature screenings at school, health screenings on the arrival at students at school. That is no longer recommended. That being said, there will be a requirement for staff to complete health self-screening, self-assessments. So making sure they are reporting that they are affirming that they are healthy and have not had COVID-19 exposure prior to arriving to work on site. And so MCOE has developed a daily screening for staff that schools that they're going to be sharing and that you can use. When I check into work, I affirm that I'm healthy and I have not had a known COVID exposure. So that's what we are recommending for staff. Again, I can't overstate this enough. We see this before COVID came, the parents sending kids to school sick. We are expecting everyone, staff and students who are sick to stay home. This is not the time to muscle through. You will be increasing fear in your school community if you report to work sick, and parents will be increasing fear in the school community if they send their kids to school sick. We will have an isolation area identified, but in the guidance that we're documenting, we are going to be reinforcing with parents that they need to be able to pick up their child immediately if the child develops a fever on site, that they need to have a strong emergency contact if they can't pick up the child, if they don't expect that they'll be on site or be able to pick up their child within 30 minutes, and that the child will not be held in an isolation area till the end of the day. So it's not, those flexibilities that were allowable before are not going to be permissible moving forward into the new school year. Testing strategies, this continues to be an evolving space for us. Testing will be part of the waiver process. So we'll be looking at private schools securing testing resources to provide surveillance for teachers. I believe it's at least every other month right now. And this is, again, a space to expect to see evolving as new testing technologies come online. We are constantly advocating for bringing those resources into the county, knowing the more affordable, more rapid testing will allow us to do a better job at case investigation, contact tracing, and isolation and quarantine. Public schools that do apply for waivers will be partnering with you to identify testing resources to meet this requirement. So this, again, goes down to the protocols around the scenarios, and we've reviewed those many times. And this is a place where we expect regular phone calls from schools every day with our public health team, so we can provide first some of the guidance that you need, and then as you become expert in managing these scenarios, that we shift more towards a reassurance role, because you'll see many times the scenarios will become basic. Those first times you have a student with a fever, it might be a frightening time. What are we going to do? And that's where we in public health are going to be ready. We're increasing our team members and in order to be ready to answer those phone calls. So we'll have the scenarios that you'll have the templates on how you're communicating with staff, parents, and students based on a potential exposure. And so we'll run through those for exposure, for communication types later on. Physical distancing, again, we're recommending at least 6 feet of physical distancing, but we've seen, again, with worldwide research and meta-analysis that why their recommendation is for that 1 meter or 3 feet or greater than that is also provides great protection for individuals or greater protection for individuals. Of course, more is better. So if it can be 12 feet from someone, the likelihood of transmission is lower. 6 feet has become what is the CDC is recommending, but again, where it's practical, it is permissible to have greater than 4 feet when they're in a classroom in a very structured setting. But again, we're not looking to see the hallways that you've seen on some of the news pictures. We want to maximize and have your physical location set up to have signage to encouraging maximizing the time that people are 6 feet apart from each other and wearing their face covers. So this is, again, goes back to the cohort size. This will be an evolving space, and we know it'll be dependent on the districts and the schools, but we are still allowing up to the standard classroom size. The goal, again, for this is to have stable cohorts and maximizing stable cohorts as we move into the school year. And again, recognizing that these decisions will be made at a district level. Right now, when we will be releasing childcare guidance, it increases the allowable number from 12 to 15. And so this is a space where you'll be seeing increases in both recommendations and practice as we evolve in our relationship with COVID-19. And again, the language in the next one, which is 12, remains unchanged. And it's a moot point right now. Right now, we do not have secondary education is not allowable. The exception to that is 6th graders can go back into a more standard cohort during a waiver period using the school site. But at this point, secondary education on site is not allowable in the state. So that's something that we'll be closely following. And again, going back to what Dr. Willis said earlier on, this is an evolving space for ourselves and as public health in our county, and it's something that is evolving at the state level as well. And though I expect to see changes and recommendations as we move forward, both could be easing up of restrictions, but I think we also need to be prepared. One of my activities is also looking at the Southern Hemisphere as we prepare for flu season, and also being prepared that there may be restrictions months in the future that are after we ease up restrictions. And so that is the challenge of adapting to COVID, is you need to be adaptable, but we are following very closely what's happening globally, what's happening nationally, the state, and within the county, and just being prepared that there may be changes that are afoot. Sometimes, and again, as Dr. Willis said, sometimes we learn on Friday what a state recommendation will be. So of course, we will always defer to the state orders and state direction. The state can be strict, we can be stricter, and districts can be more strict themselves. So again, we respect the choice of each district and just provide this guidance for as we plan to reopen schools for in-classroom.
Lisa, can I just offer one, chime in on one point, that the 6th grade TK through 6 is what's allowable now under the waiver, which straddles what we had previously determined to be sort of secondary, right? So there's a clarification that for 6th grade, we're reviewing 6th grade as being akin to elementary insofar as the reopening process, where you would have to have a stable cohort in a given classroom, even at 6th grade, which is a shift from the way he'd been approaching it. I just wanted to clarify that.
Absolutely. And so again, as we go through some of the next guidance, it's really trying to minimize transmission risk. So I know many classrooms used to try to have the group thinking, and that's a great learning strategy, but now we're encouraging all desks to be facing forward. Again, where staff can go from classroom to classroom. A lot of this, again, is the personal protective measures that are in place: wearing face covering, maintaining 6 feet distancing, not having close contact and meeting those close contact definitions that we have are very protective. We've been very successful thus far with our pilots and classroom-based activities and camps because they're maintaining these guidance. And so I think that's why we are looking towards moving forward with them, because we've seen success in preventing transmission under these guidance. So staff can visit and instruct more than one classroom, but again, wearing face coverings and maintaining social distancing. And again, back to that line list, we also just need to know if staff are rotating, what classrooms they're rotating to. So when we do have a confirmed COVID-19 case, and I expect that to happen, I think this is not, as we've mentioned since the beginning, we have COVID circulating in our community. We expect to see COVID attempt to introduce itself into our school environment. And so we'll be working to make sure that we have accurate records to ensure that we can do our best job of contact tracing when there is a positive case. And again, this is a place where we continue to see concern in the community. We have a very strong definition of what a close contact is, and that is being less than 6 feet for more than 15 minutes without a face covering. And that's because those are really the conditions that you need to be able to transmit COVID-19 from one person to another. So again, as we've mentioned before, we will be erring on the side of caution. If we do identify a positive COVID-19 case, we would shut the cohort down, even if individuals do not meet that definition of close contact. Again, and this is us to be conservative in our containment strategies as we begin to reopen schools. And that's been effective thus far with our practice throughout since March. Again, so routes for entry. And again, this is just these are the crowd control philosophies. The more you can have a plan on how students and staff are entering, so there's not huddling that's happened, but we are maintaining, and I think we're all becoming adapted to seeing the spots on the ground, indicating what is 6 feet distance, and really identifying strategies where you don't have cohorting or breaking kind of that 4 feet wall that we really want to optimize in our space. Also looking at the schedules, we've seen that globally, as well as staggering entry time or entry locations. These are all just different strategies, so you don't have a large group of children or staff gathering in one location, which increases the possibility of meeting that close contact definition where they're unable to maintain distance from each other. The congregate movement, and this is, I don't look at the media like many of you on the phone do, but I did see a picture of some of the schools opening on the East Coast. We do not have a vision of crowded classrooms. We have a vision of very structured movement, of maintaining, again, physical distance, and that children and students, adolescents are wearing their face covers. They're moving in single file with appropriate spacing, and not some of the media pictures that are out there. And that, again, I think is as a school community, and I think it's less of an issue on our elementary campuses, but as you're preparing, and I think what we really are encouraging our secondary schools is to use this time to continue to engage in the conversations that you need to prepare your schools for reopening. And again, we don't seek those pictures that we saw in the news. We want to maintain social distancing and limit those congregate movements as much as possible. We are not permitting large gatherings at this time at all. We're following the same recommendations. And that's, again, that's one strategy for minimizing that. Outdoor activity, I think, again, is the exception, is really looking at how to maximize that outdoor activity where kids are spending and burning off some of their steam outside, and that is appropriate. Oh, look, I wasn't even thinking of that outdoor is next, but it flows well. And again, outdoor is protective. We're seeing that UV is virucidal, so it kills the virus itself. Being outdoors provides the exact aeration that you want, so you don't have the concentration of virus droplets. So the more that you can maximize that time outside, the better. And again, that will be prioritized when we're reviewing waivers. Those applications will be prioritized for the inclusiveness of outdoor activities. And again, we have limited time. We know we're going to be moving forward into hotter seasons and also wildfire and smoke seasons. So again, taking advantage of the time that we can spend outside is ideal.
If you want to be inspired, you can look at some of the pictures of the pandemic response in 1918, 1919, where entire classrooms were just outside. There was basically just outdoor schools with the desks and the kids and the teachers, and everything was just the same, but just outside. and it worked.
So think outside, and that's the picture we want to see in Marin. If we make the news, is for outdoor, well-spaced education. That's our shared goal. We are not recommending the use of shared playground equipment. Even pre-COVID, my kids get sick when they're on a shared playground toys and equipment. So really minimizing the use of those equipment, and again, thinking of other physical activities that don't require using shared equipment is important. And again, the next one is the extension of the outdoor space. When we do need to move indoors, how do we think differently about the space so we can just maximize the physical distance between everyone and think of space differently? And I think that's a tremendous opportunity for many of the school sites. Again, so this next one is just around meals. And again, this is just decreasing. Our nature was, before COVID, was having congregate eating, congregate setting, sharing foods if you didn't like your food, and that's where there will be a shift where we're recommending, again, being outside if possible for meals instead of in any cafeteria environment, staying inside the classroom if you're going to have meals, just with maintaining that cohort. Maintaining the cohort is key for us. So looking at all opportunities where you're protecting that classroom cohort and designing even recess time or recess locations so you keep that one cohort intact and preventing the mixing. And then that's what our goal is, again, as we move through. This will evolve, but this is our way, again, a conservative containment strategy for us as we're moving into reopening schools.
Lisa, can I add something there? There was another element on preventing large gatherings. And one simple way to think about that is that a large gathering would be more than one stable cohort gathered together. Is we refer to assemblies, but basically if you're thinking of gathering more than one cohort together in one space, would be defined as a large gathering that would be prohibited under the standards.
And so the next one is just around hand washing, and just, again, this is making hand washing is key. There's again, those steps that we have control over is the distance we keep between each other, wearing our face covers, washing our hands, having hand sanitizer available at all times. And again, thinking outside the box of how do you bring, in addition, hand washing stations onto the campus. There's many ways to think about the opportunities for washing hands and promoting the importance of hand washing. This is one that's shifted on number 24, is around face covering. We're aligned with the state that requires all children above third grade and above are required to wear face covering. It is strongly encouraged that children in TK through second grade wear face covering. So we'd like to see all kids wear face covering in the elementary school. That being said, again, I think many of you heard me, we know the challenge of children, especially, I would say a little bit of higher grade, that's my own personal bias, but definitely under third grade, the challenge of wearing face covering. So that's why it's the language is shifted for under third grade. It's where it's strongly recommended and strongly encouraged. Again, if a child is handling a face covering and is not wearing it appropriately, we would not recommend that child wearing a face covering, and especially if it's interfering with education and learning. But above third grade, absolutely, yes, they are required. And training. So face covering, it's not intuitive. I consistently see every day people touching their face covers in the way that they're not supposed to. You're really supposed to handle it by the sides, but they fall down and then you're touching them. So again, we are launching at the county level, wearing mask face covering campaigns. We have students developing videos around face coverings. I was just on the MCOE site and saw more videos around face coverings. So again, there's a proper way to wear a face cover, and we want to make sure students and staff are trained in that as well. 26, again, just really limiting sharing equipment. We've seen success in camps where each child has their own box, and that's their stuff, and that's what they are using, and not to have the same practices of sharing, which is counterintuitive as a parent, which you're always trying to teach kids how to share, but right now we need to minimize sharing, and so we're not spreading germs. Yeah, again, and I guess the 27 also is about sharing. 28 goes on to the privacy screens. We've seen, again, those pop up everywhere. We've seen from Korea, using the plastic laminates between desks. Again, that's something that could be considered. It's not required, but it is another strategy of just blocking any transmission. So if that's feasible, then it should be considered. Really trying to limit the amount of visitors. Again, COVID enters your school community from the outside. So really trying to maintain school operations with only your essential visitors and essential staff. And that's just, again, another way to protect the community as a whole. And again, we want these school site specific protection plans posted. We want the parents to read them. We want it to be seen by staff. It's long. I know that everyone won't read it, but designing strategies that we really can educate the total community, the whole community, on how we can create a safer, healthier environment for education during COVID time. So posting it on your website, posting it on the staff areas. And that's just another thing, is thinking about this space where staff, I know it's not on here, but thinking about the space where staff gather, really making sure that you identify how many people can be in a room. It might be a printing room and used to have 5 people waiting and lining up, and now it needs to shift down to only 2 people can be in a certain room at a certain time. So again, it's really just conceiving how can we, throughout our day, start it the right way by minimizing our own social activity, staying at home when we're sick, practicing all of our protective behaviors from face covering, hand hygiene, respiratory etiquette. And then when we get on that school campus, making sure that we're staying in our cohort, we're minimizing any intermixing, and so maximizing the space that we have between each other as we're transitioning from indoor to outdoor space and outdoor time, and then having the increased disinfection and practices and having that equipment available to you to create, again, a safer, healthier environment as we move through to reopening. And you might, and I've seen this on the chat, some schools may reopen with a waiver, and that's what this next step is. Although without a waiver, you cannot reopen until we are off the county watch list. And so that's where we are now, is that we anticipate that some schools will be developing the plans and procedures to have in place to be ready for a September 8th opening under public health officer approval, as well as a review by the state. So the state will also be reviewing our recommendations for waivers. And that would be the first allowable groups to have in-classroom instruction while we are still on the county watch list. And then the goal would be, once we are off the county watch list, that all in-classroom education would return under the guidance of this 30-point guidance. There we go.
Thank you, Lisa.
Great. So Matt, at this point, do you want to answer some questions in the chat? Do you want to jump to the site-specific protection guidance and template? Just to answer some of the questions that have come up, this document will be posted and sent out through email, and it is, available as of today. So we're considering it updated as of today. As we move to this site protection plan, just as a reminder that any of you that are considering applying for waivers, this site protection plan will be required as part of the waiver. And so if we could get a look well, here, let me ask this questions real quick. We just got a question from one of our superintendents that Matt is going back to the guidance from July 17th that permits small cohorts of students, no more than 12 or maybe 15 now, to come onto campuses now prior to September 8th in order to meet their teacher, have the chance to follow some protocols about what safety is going to look like, be assessed, etc. So if you could talk about that, one. And then number two, that we have had some pilots that have been operating since May 18th in special ed and alternative ed, and the fact that those programs as well will be continuing without a waiver.
Yeah, so we think it's important that, especially if we're opening the year to distance learning, that the children and staff have a mental model and an understanding of that school environment, and have a relationship that's established with our teacher based on a face-to-face encounter. It may be the first time and only time they see that person in person for a matter of weeks or months. And so to facilitate that, we're allowing in-person attendance as a way of orientation to that space before the beginning of the school year, or at the beginning of the school year, and that's been defined and because we are now moving in the childcare setting from stable cohorts of 12 to 15. That's the number that's been defined as the acceptable number for that experience as children start their year on site, with all of the provisions in place. I mean, I think hopefully it's at a certain point it'll go without saying that we don't need to say each time that we're expecting that people be covering their faces, that they be practicing physical distancing, that they don't attend if they're feeling ill. All that stuff is assumed to be in place in any of the encounters that we're describing. And then what was the second part of that question?
The second one was that we've had pilots that have been operating. Yeah. Special education programs for 0 to age 22, as well as alternative ed.
Right. Our goal is to not suspend anything that we have allowed thus far. We've had a lot of success as a county in meeting the needs of some of our special ed students and others in safe, stable cohorts, and that will be allowed to continue as we have defined it, until and unless we hear from the state that is categorically not allowed. For us as a county, our plan will be to continue with those. And again, we've demonstrated, I think that's something that has been a really great demonstration of the principles and practices of safe reopening that we can build upon.
Mm-hmm.
There was a question about those orientation days. We do see, as long as you maintain the cohort and have, for example, staggered arrival, you can have multiple cohorts on site for orientation days. Again, almost building what a school day might look like when we do return to in-classroom instruction. So again, it's the key would just be staggering time so you don't have gathering of parents, making sure you're educating people in advance how to arrive safely, that parents, are staying for example, staying in their cars, not coming on site. And those are things that we would hope to see in a site-specific plan. But it's not just one group of 15 that can come on the campus. You can have multiple groups of 15 come on the campus for orientation with their teacher. Again, as long as you're maintaining the guidance that we have provided.
Great. So Mike, if you could move us to the site-specific plan. And while this is an exact alignment with the 30-point plan, there are some components here that provide guidance related to what the best practices have looked like in our county in terms of setting up the task force at your school that would be broad-based stakeholders, so that they are part of the development of the plan, but more importantly, or as importantly, they continue to monitor and see how things are working, see if there are any revisions that are needed. And then I think if you look through this, I mean, it essentially frames just the basics. But Matt, Dr. Willis, if you could just talk about, so this is the site plan. Reminder, it's very important because in order to get a waiver, this has to be complete, or to open school, right? You have to have this document ready to go. But there's a section then that goes to each point in the 30 points. And if we could go there just for a second. So Dr. Willis, originally when we had shared this as a draft, we did not actually have spaces for those developing this to put in detail about each section. So could you describe how important it is that you have a good understanding about exactly what people's plans are, as opposed to some general sentence as they look at, for example, number 2 there, health and safety practices.
Yeah. So there's been some questions in the chat. When we say quote unquote the plan, what are we referring to? Is it the 30-point recommendations, or is it this? And they're the same. And essentially what this is a way to document for us that you're adhering to the elements of the 30-point guidelines, which I think simplifies the process. The concept of the site-specific protection plan was defined in the Marine Recoverers Group for any sector that's opening across the county. All the business sectors, recreational, et cetera, all have to do a site-specific protection plan, and this is the version of that for schools. And it's both, the value is both in making sure that, you know, it ensures that you're going through the process institutionally to understand and adhere to the standards. And then it's also provides a reassurance for us that as we consider decisions around reopening, that we can feel a measure of security that you have the standards in place to assure the safety for both staff and students. And so to the degree that as you're filling these out, you can be specific in what's being requested is helpful for us. As we know with a lot of these plans, if it's just a checkbox, there can be a wide range of understanding and adherence to that. And so each of them have a place to actually fill in details. For example, number one, multidisciplinary task force has been established, develop and support school site specific protection plan. Rather than just a check yes, as an example in this box, you might say we've developed a multidisciplinary task force that's made up of X number of staff, parents, school board, whatever the configuration is, with the scheduled meeting weekly initially, and then 2 weekly, whatever your strategy is, to articulate that so that we understand how you're interpreting that recommendation and ensure that it's adhering to what our expectation.
And also another thing to add here is that our teams at MCOE and Public Health will be reviewing this, and this offers us an opportunity to build a learning community where we can see there might be best practices that are being developed at one school site that we would want to share more widely. We're learning together how best to do this, and you again, we see you as experts of your school in your community and your facilities, and we'll be reviewing them again, seeing if there's opportunities to bring out some, again, best practices and shared learning so we can support other schools getting back online and into the classroom.
I love that point. Yeah, I mean, there's so much great work happening. I mean, people are innovating, and we all have to be. And we don't, without direct communication, it's hard for us to see what are those best practices. But I think as a general principle, kind of identifying best practices and accelerating them and spreading them across the community, in fact, across the state, is a goal. And this becomes one tool for us to sort of see who's doing what, to magnify that.
Do you think?
So I don't know if we need to go through every one of these.
No, I don't think we do. But perhaps we could just go to the bottom where the timeline is identified, Mike, just to give people an example of what they might expect in terms of ultimate timing. And these boxes, by the way, for some of you will not be enough information, so you can attach information. I think that's already been identified.
And Mary Jane, the wording of each of these is identical to
Yes.
Yeah.
Yes. Right. Okay. Okay. Oh, sorry. So now we're getting to the actual waiver process. So Dr. Willis, yeah. So do you want to start at the top of this? Yeah.
Sure. Why don't we start? I think we can start with, where are we at the timing?
Yeah, that's at the bottom. So if we start at the top, a lot of
Okay,
it's duplicative, but
Yep.
I think important.
And we've gone through you've had one conversation with many of the schools that are intending to apply for a waiver already to go through the process. I've been through what the criteria are. One of the chat questions just to clarify the numbers because it's important that we understand them. Our current incidence as measured at the state, and I think it's close to accurate, although the caveat that there's been some data issues at the state that we'll clarify in the next 2 or 3 days. But our number right now is 160 cases per 100,000 residents over the past 2 weeks. We need to be below 100 in order to be able to reopen schools without the waiver. If we have above 200 per 100,000 residents over the past 2 weeks, we may not move forward, even with a waiver. So I would not have the authority to authorize students, schools moving forward. So that's where, so we're in between right now. So we're in that where the only way the schools are going to reopen to classroom-based learning is through health officer approval of a waiver application, and we are likely to. And now those are the facts, and now the editorial is that we are likely to stay in that space for at least I would say 2 months, and this is again pure sort of forecasting based on just what we see as the pace of change that we can expect. And so our goal would be, again, the faster we can get control of the virus spread within the community, the sooner we'll be able to get below 100. And our goal, once we're below 100 and the state allows us to reopen to classroom-based learning without the waiver, to more widely reopen both public and private schools. So those are the numbers. So here's the waiver application process. We published our guidelines. We've just been through the guidelines updated today, August 12th, and they will be sent out to you, those 30 elements with the school site protection plan. You will need to fill out that plan with the specificity that we indicated and attach it to the application. Importantly, the superintendent, I'm on the third bullet here, the superintendent, equivalent or designated staff has to have consulted with labor, parents, and community organizations as required by the California Public Health. And if there's no labor available, the school has to consult with the site staff specifically, and that's importantly for private schools especially. For private, independent, and parochial schools, you must have a plan to perform COVID-19 testing that includes surveillance testing of all site staff on a 2-monthly basis. The best way to do that is about half staff every month rather than everyone on the same day. And then working with public health to perform testing associated with school-based COVID-19 cases, exposures, or outbreaks. And those would obviously be, those decisions would be navigated very closely with our public health team. And schools should be using a vendor that has turnaround tests within 72 hours. And again, this is an environment that is expanding rapidly. There are more and more options for this, and we can help provide lists of testing operations. Public schools would coordinate with public health on a plan for performing COVID-19 testing that meets our recommendations. So there are other testing opportunities throughout the community through some of the healthcare providers and then through some of the public health, and we would be working with public schools on those. As Lisa indicated in the guidance, schools have to identify a primary and secondary point of contact who we would train to be the liaison. And be that key person that we would reach out to if there was a question of an exposure on campus or there was an established case on campus. It's vital for us to have one person there who has access to the information. We were expecting that attendance be maintained, that rosters be maintained, someone who we could work with who understands beforehand what the expectations are and what that process will be so that we can have a timely response. The superintendent needs to follow public health and CDC and CDPH guidance to determine triggers for switching to distance learning. And when physically close a school, suspend site-based classroom. So we've been talking so far about triggers and indications for reopening schools. Obviously, once schools are reopened, we recognize that it's highly disruptive to be closing and then reopening and closing. It's one of the reasons why we would expect the incidence to be beneath 100 for widespread countywide classroom-based reopenings. But the triggers for closing schools are also clarified by the state and have numbers associated with them. So that's not ambiguous, but it's actually clear in terms of the number of cohorts that have had been closed over a certain period of time, or the school district level, the number of schools that have had to close cohorts over a certain period of time, as an indicator that incidence has increased enough in the community that it's more disruptive to try and maintain schools open than to make a decision to resume distance-based learning. Those are not here specifically numerically because the state is still finalizing those numbers and that criteria, but we will be offering that, and we can have a separate conversation about that once we know what that final guidance is. And then finally, just having a 500-word overview of the context of the waiver application, including unique situation, et cetera. This is where we would, and the waiver application, this is a draft, mind you, of the waiver application. We are going to actually finally submit the waiver application on Friday. The school site specific protection plan will be offered today along with the 30-point recommendations, but this application is being finalized over the next 2 days. And one of the elements that is being, the last element is the way in which we would expect what is referred to as a demonstrated commitment to educational equity. And what does that look like specifically? Because obviously it's easy to describe that conceptually, but we want to offer you more specificity in terms of what that would mean in terms of what to attest to in the application. So that piece will be forthcoming. And once we finalize that, then you can expect the waiver application on Friday of this week. This is the timing. So the applications that are completed by next Friday, so you can expect the application this Friday, would have a week. Those that are received by the following Friday, we will give ourselves until the 28th to review them. We would get them to the California Department of Public Health, which also then has to review and approve our, so if it's approved at the local level, it also needs to go to California Department of Public Health. They are promising a 3-day turnaround on that review. And so we would then expect to have a decision for schools that then maybe be able to reopen on Tuesday, September 8th. And then that whole sequence is being put back 1 week for the applications that would be received by the 24th with the potential opening on the Monday, the September 14th. Importantly, and I want to be clear in this level setting in terms of the expectations. This is not a sort of a de facto, or a pro forma process where just submitting the application is sort of equivalent of being expecting to open. We are going to be, expecting that schools really do demonstrate that they're able to reopen safely. There may be some back and forth with the school to clarify some elements of the plan. And then we also, importantly, will be looking at our local incidents. And there's a week, 2 weeks, 3 weeks makes a big difference for us in terms of establishing our trajectory as a county. And if we start seeing demonstration of increased cases within the county, that's going to be an important factor for us to make a decision to perhaps delay, even in the waiver context, reopenings. And then the asterisk there, again, what Lisa already mentioned, that there's priority will be given to schools that serve low-income communities, outdoors, those that have demonstrated a track record of providing services to students in the spring and summer. And I think does that conclude the waiver application?
Yeah, do you want to just scan through that quickly or go right to the questions? We have quite a few.
Let's get to the questions. Oh, is that that's the application itself? Let's just work through the application, sorry. Yeah, it's pretty self-evident. It's just, you're just putting your information in here. Continue down. The elements you would expect to have to define. The testing vendor, if applicable. So for private schools, naming the testing vendor. Next. And then consultation, making sure that the elements of necessary consultation as defined by California Public Health for stakeholders to be in part of the process need to be documented here.
Hey, Dr. Willis, there's several questions that came up on what is consultation? Does everyone have to agree? Does it have to be consensus, et cetera? Do you have a thought about that?
Our goal is to ensure that when a school reopens, that it is based on consensus of the key stakeholders to allow that to occur successfully and safely. That's, we don't want to get into a process of approving a waiver that is divisive at the school level. I don't want to get into, we don't want to get into the middle of that. We need to make sure that there's alignment and agreement at the school level, that there's a collective decision to take that step to open to classroom-based learning. And then we will be judging it according to the merits of the public health considerations around safety, and don't want to be coming into having to considering we want to make an assumption that those conversations have occurred, and that there is, if we approve it, that the school will resume classroom-based learning based on the conversations that had preceded the application. Does that help?
Yeah, no, I think it does. Thank you.
And then again, that highlighted there, how will the applicant support equity in Marin County? That's the element that we'll be clarifying between now and Friday when it's released. And then, just the other organizations that are required to be involved need to be named there as well. And then we've been through this,
right?
This place. So there's the waiver application. The most important piece is going to be the school site specific protection plan,
Right.
and the specificity in that.
Okay. I'll try to go through as many questions as I can. So this is another question related to the issue of testing, or the data, 100, right, per 100,000. And then today you referenced that number of 160. Is there a place that a member of the community could see that number? What is our current number is relative to 100, the need to be at less than 100.
Yeah. That's normally available. It's not available now because the errors at the state level. So we want to make sure that we're projecting the right level, the right number. But it's on our coronavirus.marinhhs.org would be the place to find that.
Okay, so this one, just for everyone on the call, this continues to be a question that comes up because people are looking at different places. So as soon as we have that, that will be really helpful to our community because everybody's watching that number, right? To try to, are we at above 200, below 200?
Well, yeah, and I mentioned that we had a direct relationship with the laboratories to get our own reporting number. So there was an interval there where if you looked at the state, because the state also counts that number and reports it out, and you can look there. The problem was the state was undercounting, and had to offer an erratum, an apology for having undercounted levels. We knew that they were undercounting. In fact, Marin was one of the first to signal to the state that we thought they were making a mistake because we were seeing our own cases and they weren't seeing them. And we had our number was much higher than the state was reporting for us. So that was, so the state does have numbers for Marin County, but I think they've actually suspended their website also until they've corrected their problem there.
So just confirming, do private schools need to have their own testing vendor for both surveillance testing and testing for a school outbreak?
Yes.
Licensing last week said that 12 was the child care preschool limit. Am I clear that 15 is the number that we'll be using in Marin?
Yes, we've increased that number from 12 to 15.
What does the data say internationally regarding cases and hospitalizations in teachers and staff as schools have reopened in Europe, Asia, US, Canada?
What is the number of the
Cases and hospitalization for teachers and staff as schools have reopened?
across the world?
Yes.
I don't know.
What is the number for kindergarten? What is the cohort number that is available?
So we're using the standard classroom size to determine that cohort number, with the added element of requiring at least 4 feet.
Do we call public health hotline for guidance on exposures, etc.? 473-7191.
Yes.
Questions?
Yes, that's the number.
Many
We're ready.
people. Okay, good. Many people were asking about the 30-point plan. It's now posted on the Rethinking Schools website.
Yeah, and I can, it's similar to the plan that you would have seen in almost all. There have been some changes, but it's very similar to the.
You've answered this, Dr. Willis, but could I ask it one more time?
Yep.
Do you think we're going to be off the watch list by September 8th? If not September 8th, when?
No, so I think it's unrealistic that we would be off the watch list by September 8th. So for schools that do not have waivers, it is unlikely that we would be able to open to classroom-based learning. I'm forecasting and don't have a crystal ball, but I would say that it is unlikely that in the next 2 months we would be off of that list. But we are seeing improvements in our case numbers, and we saw a relatively rapid increase in mid-June. And if we saw a correspondingly rapid decrease, we could come off of the list sooner.
Can you talk about the change in health screening? Lisa, whoever. Why no more questions, temperature reading for K-12, or asking about family members with a cough?
Yeah, the temperature, the screening has proven to be not as effective as you would think intuitively, and it's partly based on literally tens of thousands of screenings that have occurred when people are coming into settings where virtually no one is endorsing that they're having symptoms, or that the ascertainment of symptoms in that setting was different than the ascertainment of symptoms at home. Furthermore, that operational expectation that you add that into the inflow process can sort of paradoxically actually lead to crowding just in itself, because you have to have a moment where someone is waiting and there's an exchange there, and you have to have enough channels to do that so that people can continue to move. And that the expectation that temperatures be taken was similarly causing some crowding, might have actually caused closer interaction between the temperature taker and the person, and that the ascertainment of meaningful like fever that wasn't otherwise recognized or wouldn't have been recognized otherwise was limited, and that a significant fraction of people who are infected with COVID-19 do not have fevers or would not have the fever at that particular moment that their temperature is being checked. So all that together has led to the CDC to change their recommendation. It's not a recommendation specifically against it. It is, and if there are psychological reasons or reassurance purposes that people feel like that would be something, a step they want to take, it is obviously permitted. But just to take into account the limitations that I just described.
And the other thing, I think what we're seeing just on the ground is most of the COVID transmission that we're seeing is household-based transmission, where there's, again, a known COVID-19 exposure. Most of our activities, if we're following public health guidance, really should limit our own exposure to COVID-19, especially those who have the privilege not to live in crowded housing situations and working low-wage jobs in many of the more at-risk environments like our nursing homes. So I think that's, again, why the other part of the home screening that's offered by CDC is part A is that looking at symptoms, but part B is looking at the risk of exposure. And again, that's a place we all have a lot of control about, limiting our activity, limiting our mixing with other families and large groups to reduce any potential risk of exposure to COVID-19. And that is a big driver, at least in Marin County, with what we're seeing.
Where are we on the guidance for school buses?
Guidance for school buses?
Yeah, we're close.
Yeah, we are close. Lisa, did you?
We reviewed the transportation guidance yesterday. We'll be finalizing it. We're looking, again, windows down on the school buses. We're not having temperature screenings at the school bus. We're really going to be relying on parents completing the home-based screening before bringing their child to the school bus. Using one child per bench right now, which again impacts transportation. We significantly understand that. But children will be wearing face covers on the school bus, and we'll have proper disinfection of the school bus afterwards. So transportation is a key part, especially for many vulnerable low-income students to come to their school environment. So it's a priority for us to get them back online and keep them safe. And again, this is a space we've seen our transportation companies have been successfully operating. We've had, when the exposures that we've seen have not come from exposures on a bus or in transit, it's come from staff who have had home-based exposures to COVID-19. And that's where, again, that's a very big primary driver for us across the Bay Area, are these household transmissions and interfamily gatherings that increase that, that possibility of mixing. So we have had successful transportation online in Marin County and the Bay Area since the beginning. It's been deemed an essential service. And we see bus transportation and buses as an essential part of the school environment and getting kids to school for in-classroom instruction. And we have protocols to ensure that both staff, bus drivers, and students are safe. And so those, I believe, will be released on Friday as well.
Another piece, another sort of silver lining, if there are any, around COVID-19 is that bicycle use has increased significantly. This is a great opportunity for safe routes to schools and others along that principle of outdoors being safer. It's also healthier for children to use non-motorized transportation to get to school for all the other health benefits. And this is a great year to really jumpstart that as the expectation.
How do we resolve the issue that students will be mixing cohorts when they're on a bus? No, this is a place, there is mixing in our lives. We want to take every effort we can to reduce mixing, but there will be, again, on our school bus, you have first graders through fifth graders, and that is a reality. That's where, again, our protective measures will be critical, where the children will be wearing their face covering, they'll be at least 4 feet apart from each other, and maximizing that to reduce the risk of transmission or COVID-19 transmission in that environment. There, again, also this is a place where it may be more than 15 minutes that a child is on a bus from the first bus stop to drop off at the school. So that's why, again, windows down, letting the outdoor air in, wearing face covers, and maximizing distance even on that bus. And this will, again, be a space that evolves as our community adapts to COVID-19 and as we hopefully move towards decreasing prevalence, though always being vigilant, because we are preparing, and we probably can't overstate this enough. We're seeing this in Australia. They're having their second wave. So we control a lot of our wave. It was the post-Memorial Day increase of social gatherings and activities that led us to this new increase, and staying vigilant, especially as our own responsibility to keep schools, when schools go back into the classroom, we need to stay vigilant to prevent us from having a second wave in Marin County.
And the visual image of a school bus as a kid, there's the window aisle, one child per row, alternating odd numbers windows, and then on the opposite side, the opposite configuration, so that they're optimized at least 4 feet apart. And you get 28 children on one conventional size school bus with that configuration.
Dr. Willis, would you consider a waiver that came in for a specific program at a school, let's say the TK and K program only?
Yes.
Okay. All right. Sorry. It's the beginning of the year. I have a large, well-ventilated room with appropriate physical distancing and face covering measures in place on campus. Would I be able to have my staff in that setting?
Yes.
Do you recommend families and staff quarantine 2 weeks before school starts?
No.
What's happening related to the timeliness of testing currently using the color, I think it's called the color program. Is the testing timely?
Yeah, color is an example of one of the positive changes in the testing landscape. You know, we now perform color testing at our point of testing site near the Civic Center, which had been the drive-through site established under public health in March. And color is it's an online self-registration process, 2-day turnaround, and we're actually getting even 1-day turnarounds on that, and they've been super reliable in performing 300 tests a day with rapid turnaround.
Can I clarify on the testing that there's a strong recommendation that we would like staff to be surveillance tests before the first day, but it's not required, quote, even though we're strongly recommending it. And then we will be providing testing minimum in that surveillance every 2 months. Is that accurate?
Right. Yep. Yeah, and it's not required. Our hope is, like so much of this, is that there's a common understanding within our community that this is something that we do for one another as a matter of community welfare and social responsibility. And so but that when there's actually an outbreak or a cluster of cases or known exposure, that's where we can actually exclude someone from that environment if they don't have demonstration of a test result, and up to 2 weeks. To be required to remain at home if there's a known exposure.
What's the duration of a waiver? I.e., once we come off the county comes off the watch list, is the waiver no longer relevant? However, the school site protection plan is? Question.
Yes, that's right.
Thank you. For in-classroom seating, is 4 feet the number?
4 feet is the minimum number. Yeah, and everything's changing so quick. Just yesterday in JAMA, which is kind of the premier medical journal, there was a clarification of some of the operational considerations for the American Academy of Pediatrics guidance that said that 3 to 6 feet, that 3 feet with facial covering is equivalent to 6 feet without, and they're our sort of premier guidance in terms of the health of children in that pediatric association is authorizing in their own guidance less than 6 feet, especially with face covering.
If one of our staff members tests positive through a surveillance test with, let's say, the color company, will the school district be notified?
Yes. We are notified in public health of all positives. I've said this before, we really do depend on staff and parents reporting to the school if they receive a positive lab test. Sometimes the patients receive their results before we do, but Marin County Public Health is notified of all positives. And if we are notified first by a laboratory, we'll make contact with that school liaison. Again, really, our goal is to have a roster of all the liaisons at all the schools in the county so we can rapidly make contact, as well as with the school nurse who is responsible for that district in order to manage the next steps in determining if there needs to be a cohort closure or and managing that process. And again, I think that will be something that we'll see us evolve depending on the prevalence of the disease in our community, and as we adapt to it, with a vaccine possibly going online, is and I think that for people to be prepared for, we're taking very conservative containment measures of cohort closure in the beginning of a positive COVID-19, and that may evolve, but not in this year.
Mm-hmm. In the case where the union has signed off to a memorandum of understanding, would that be considered consultation from your perspective, Matt?
Yes.
Yes. Okay, I think we're there. Thank you very much. Thank you all for the questions. I think we got to most of them. So just a reminder, this Friday, we will be providing the information related to the waiver application along with the application. We also hope that we will have the information related to transportation. Just for you all to know, there's been a broad-based group that's been working with the Rethinking Schools team around transportation. So thanks to everyone who's participated. Lisa, would you just mention, we also worked on substitutes last night when we were going through, and did identify that substitutes would be able to move between schools. We would have them following the same testing protocols, right?
Right.
And keep track of where they are, that we would want to.
Again, I know this is us navigating to a new space of being together, but even a substitute teacher, if he or she are following our guidance and recommendations and maintaining physical distance and maintaining wearing a face covering, they can navigate from one school to another. We know substitutes play a key role in ongoing education when teachers are out. And so, of course, we want to try and minimize as much as possible. But again, our expectation is that there should be limited opportunity for disease transmission if they are maintaining the personal protective measures that we are recommending. So.
Yeah, and just for you to know, we had the first substitute training this week to provide the high-level overview of the 30-point plan, precautions, etc., and over 100 people did participate. Okay, so with that, yes, please, Dr.
I just want to, I just want to thank everyone for participating in this conversation, and for Mary Jane Burke and the Office of Education for just setting the groundwork for, I think, the kind of communication and collaboration that we're going to need to navigate this really challenging time for all of us. It feels like this has been a marathon already, but the reality is that we're really just at the start of, the school year. And this is going to be, we're going to need to stay together, and we're going to need to stay in close contact and assume that our best intentions. And I think that's, we all do share the same objectives of health and well-being and safety. And so we want to just, each of these conversations is where we are at that moment. And this is where we are right now, and we will have to adapt and work together. And so we will, our promise to you is that we remain available, and we will continue to keep channels of open communication and do our best to meet the needs of the adults and the children in the school environment.
Great, thank you very much. Thank you, Dr. Santora. Thank you, Dr. Willis. I'm sure I'll be talking to you later today. Can't wait. Bye.
Bye.